Good morning, everyone. We're going to try to stay on time, so please help yourself to a seat. I'd also like to bring up the folks that are doing opening remarks. So Dr. Kathy Insel, Dr. Rick Schnellman, Miss Lindsay Goldman, hello. So you guys want to go ahead and sit because you're part of the opening remarks. Yep. And we're just going to do handheld. Lindsay, you two, please. Yes. Sorry. Okay. Actually, do you want us in order or what do you want? Doesn't matter. All right. Lindsay, yeah. Yep. And Dean Schnellman, you as well, please. you come to the stage. Great. Thank you. And I hope everyone can hear me okay. Good. Good. Wow. Good morning. Welcome to DC. Welcome to our second summit for the Innovations in Healthy Aging. This is on building resiliency in healthy aging research. My name is Tara Sklar. I will be your summit host for today. And I am with the University of Arizona College of Law, but I've been working with Innovations in Healthy Aging for the past few years. And it's just, you're going to hear a lot about this initiative, but it's really an incredible effort combining researchers from across the U of A and multiple disciplines to bring us today to talk about really how to improve the aging process across the lifespan. And as part of today, many of us here in the room have come from all over the country. We have many different backgrounds. And so one thing we'd like to do to make this a bit more interactive and fun is we've created at the very start of today's session, after our opening remarks, an arts and aging panel where we're hoping to really engage all of our senses in through what you may recall from your homework assignment prior to the conference starting, was called for awe walking, where to create a moment that really struck you. And so it's just a way for us to begin to engage with sharing stories, really connect with each other, because the ultimate goal of today's summit is that we keep in touch after the summit. So I'm just going to quickly kind of go through what to expect over the next over the day. So you can follow along in your handy accordion program, which all of you should have. Just to give you a sense, so we'll have some wonderful opening remarks, which I'll introduce in just a moment, and then our arts and aging session. And then after that, we go into 3 panels. And these are each going to be 90-minute sessions, where we have an expert from the U of A who will help moderate the session. And the reason we've done, and this moderator also help set the scene in terms of contextualizing how these research studies are adding to the field, and as well as facilitate the Q&A. And then we have wonderful researchers who have been supported by the Innovations in Healthy Aging Initiative grants, presenting their research, and then some fantastic discussants who have really looked at the researchers' proposals and thought about how it fits with the overall contribution to the area, and propose some ideas for future collaborations and hopefully funding going forward. So that's why we've set up the schedule the way we have, with some time for Q&A for all of us. And hopefully this will bring us together in terms of, more than the traditional model of panel presentation, Q&A, and really helping us engage one another and share our own stories in this area. So the other point that I just want to touch on is I'm really delighted that we have created Innovations in Healthy Aging Advisory Council. Several folks are here in the room today, including Ms. Lindsay Goldman, who is the CEO of Grantmakers in Aging. You'll be hearing a lot about her and her foundation later this session. And a number of folks have been joining us online, including from the National Council on Aging, Jillian Barnett, Vivian Nava-Schellinger from SCAN Foundation. We also have a representative from Arizona, Christopher Mathis. who used to be an elder law attorney, and David Freshwater, the CEO of Watermark Retirement Communities, and Christy Kramer should be joining us. I don't see her yet, from Leading Age, as well as Tom Barnard, who has a long-term care practice with Baker and Donaldson. So it's just a tremendous group of really influential folks that we're happy to partner with. And I also want to give a big thanks to the planning committee. They really brought this all together, especially Anissa Westcott in the back there. You may have received her emails. Yes, absolutely. Just fantastic. And we also have the lovely Carla Nunez, who I'd like to draw out, if you could raise your hand, because she will be, oh, thank you. She will be our timekeeper. So she has, for all the speakers, please pay attention to Carla right there. She has a 5-minute card, a 2-minute, a 0, please conclude. If this is an issue, we both have this sign, and I will be approaching the podium. So keep that in mind to our wonderful speakers. So with that, it's just my pleasure to introduce our director of the Innovations in Healthy Aging Initiative. She's also the Associate Director of Strategy and Development at the Arizona Center on Aging. She's a wonderful colleague and friend. Please welcome Dr. Kathy Insel.
Thank you, Tara. Well, I'm going to rush through because I've been told I only have 5 minutes, and if there's a 5-minute warning, I'm already in trouble. We are trying to build a better future for aging at the University of Arizona, and I'm so delighted to have each of you here and to have people I just want to talk with, throughout the room. So I am Kathy Insel. I am very privileged to be the director of this strategic initiative that turned into Innovations in Healthy Aging. I want to also give much credit to my colleagues, Dr. Mindy Fain, who without you and the foundational work that you've done through the Arizona Center on Aging, and your partnership and collaboration and collegiality, and Esther Sternberg, oh my gosh, standing between these two women, I have the softest smile on my face because I am so strengthened by them. And Anissa Westcott, you are one in a million. Thank you so much. I also want to acknowledge the working team members, and I must say that we've had tremendous support from Dr. Michael Dake. He was visionary in the ideas that we were already doing so much work in aging at the University of Arizona, but having individual groups, maybe we could elevate everyone by having a combined effort through the initiative. I remember a drawing he did on a whiteboard with aging in the middle and all these components at the University of Arizona that really fed into our vision. So Innovations in Healthy Aging, the goal is really to eliminate the shortage of health professionals in Arizona and to close the gap between health span and lifespan. So our primary aim was to influence the critical factors that affect health of an aging population. We do that because of everyone's collaboration, not because we're doing it, but because we're trying to highlight what all of us are doing. So we set out to create an age-friendly University of Arizona. That application is pretty much ready to go in. We are definitely an age-friendly university. We're trying to pull people into the university, and we're trying to outreach into the community. And that community is local by and large, but it's also statewide and national. We also started by partnering with developers of senior living communities. Nancy, I'm so happy to have you here. You'll be introduced, of course, later, but thank you for that because you were instrumental in that effort along with Esther Sternberg, and to expand our capacity in research. So we had some initiative funding. It was pulled, I got to tell you, when the pandemic hit, and we kept everything going collectively, and then we got some funds to continue with seed funding. So I was so grateful to have everyone still through that dry spell, so to speak, continue to work forward. And we are definitely focused on increasing the workforce to meet the opportunities and challenges of our aging population. There are components of age-friendly universities, which you can read later. I'm not going to dwell on right now because I don't have a lot of time. Esther will talk more about this graphic that we developed, but I distinctly remember sitting there with Ole Teen House, Mindy, Esther, others, creating this idea of what is an optimized senior living community when we were working on the partnerships with the community. Certainly, I love Venn diagrams because everything in my mind overlaps, you know, and things are gray. I'm a lover of impressionist art for that very reason. They all kind of blend together. But it shows you the kind of categories, or when we think about the components of what constitutes healthy aging, you know, I would say cognitive and emotional, which of course emotional is cognitive, and physical, spiritual, and social cultural. And I wouldn't have thought about all of those except the team effort and brainstorming together. And then with Esther and Nancy, you know, and their influence, building a smart and adaptive environment and what constitutes that. And also leveraging technology in our world. You know, how do we support healthy aging? How do we support people staying in the community, living in their own homes for as long as possible? And how do we also monitor health? So there's a lot going on in that realm that others will be working on and talking with. I'm going to just jump over that. We do have a program, an interdisciplinary group where we're working on we have developed a certificate in aging, and we're working on the master's. In fact, I think that's been approved, hasn't it, Mindy? Yeah, thank you. And then in research, we're focused also on supporting, thank you, behavioral science, living labs, biological studies, community participatory research, grand challenges of healthy aging. These are just an example, and it's scrolling, but I don't have time. I know. I've already seen it, Carla. So I want to particularly focus on the centers that we have that are synergistic with the aging effort. Certainly the Arizona Center on Aging with the 5 components. I wish I could talk about each of these. Hopefully you'll get to see that later. And principles and highlights. And Yanko, thank you so much for your presence today. Mindy, thank you so much for your presence today. You can talk with these 2 co-directors and also point out Linda, who's been instrumental in the educational effort for improving the workforce that we have in aging. The Evelyn McKnight Brain Institute, Carol, thank you so much for being here. You will be talking, I'm sure, about that as we go on. So. And Lee, thank you, Lee Ryan. And then Precision Aging Network, which is an effort that you and Lee and Esther and Meredith Hay, Roberta Britton, Robbie as we call her, and Matthew have put together to get more focus on predicting early cognitive changes. So and I'm sure I haven't captured that completely, so you'll be able to do that for me. Center for Innovation in Brain Science, this is Robbie's, and focusing on you know, what we can do to intervene as well from a pharmacological standpoint. What are the mechanisms of pathological aging? And then the Arthritis Center would be remiss if I didn't talk about that. And now, what a great intro for Rick. Rick, what happened to Rick? Oh, there he is. Okay, good. I thought, oh no, did he disappear from the room? So our newest center is the center, the Coit Center for Longevity and Neurotherapeutics, and I will let him talk about that. Thank you very much. Please visit our website. And Rick. I should say Dean of the College of Pharmacy as well.
Thank you. I'm known to be brief, so you guys don't have to worry. So it's great to be here today. Thanks for the invitation, and I'll be brief. So we created the Coit Center for Longevity and Neurotherapeutics. Can you hear me okay? Okay, good. And it was about 6 months ago, so it's one of the new centers for us here. You can see the purpose and the mission, which I'll allow you to read. And then we have some new faculty that we've hired. Bernardo Lemos is an expert in longevity, and Hangning Zhu is an expert in neurotherapeutics. So it's a co-director for the center. And me, I'm the schmuck that is in the dean of the college pharmacy. So what I want to share with you is that the 5 things here on the left, which are our goals, is to determine causes and mechanism and underlying aging of neurodegenerative diseases, Alzheimer's, Parkinson's, and ALS, identify novel therapeutic targets for drug development to modulate aging and neurodegeneration, develop biomarkers to monitor healthy aging and disease risk, and conduct clinical trials for interventions in longevity and neurodegeneration. And also at the end, we can't forget about work development and development of jobs. So everybody's seen a slide like this one before, right? It's going to tell you what Alzheimer's and some of these other dementias, the effect that they have on Americans, and you can see there $5 to $6 million Americans had these type of diseases several years ago, and then the number of deaths, and then the 3 million of disability adjusted life years. So it's a terrible problem, as sentenced with all of those words. Here in Arizona, just one Arizona Alzheimer's statistic is that in year 2020, 150,000 people had Alzheimer's, and I think now at 2025 it'll be 200,000. So that number is clearly going to go up. So one thing that's extremely important, and that is, as you've said, right, there's a lot of aging research is going on at the U of A. And so we're just another one coming in. And so the whole point is we will work with all our partners. That's the goal. The thing that I think we bring to is that drugs, right? We think about drugs every single day, every hour of every day. So the faculty, that's what they do, and hopefully, I'm not suggesting miracles, but I do think this is an added thing to our group at the U of A, and I need 2 minutes yet. Thank you for being so quick. In addition, there's new technologies and development, and the College of Pharmacy, as well as the College of Science and the College of Medicine. We have a lot of different people in there that's working on this, and as a result, there's spin-out companies that's trying to do things like that. So we have the capacity to do those type of things. The big thing here on this slide here is about the biological clock and new technologies. And the big thing that we need to focus on is that a lot of the disease and aging, et cetera, goes along the slide here, up there where it says age-related comorbidities, right? So that's one of the big problems we need to deal with, right? And that is decrease those comorbidities, age-related ones in particular, because if you do that, right, it's going to make it a whole lot easier to have a longer lifespan. So I think that's really an important part of all of this. We have a biological clock, which is take too long to explain, but the whole point is we can measure this now. That's the key part of these biological clocks, is that we can link chronological age back to a unit, which is recombinant DNA. So anyway, we can measure that now, and I think that'll be helpful. Let's go here. The other things, we use technologies like brain on a dish. It's nothing to do with dinner. But anyway, so in this case, right, you have healthy people and you have people with age-related diseases. And it doesn't even need to be with Alzheimer's. But you do that and you isolate skin cells, make sure skin cells, and then you can turn those skin cells into stem cells, and then you can take the stem cells and create glial cells and neurons. And then when you put all those together, you get an organoid. And so why do we want to do this? Because you can study the disease in many ways. And not only that, it is easier to do drug discovery with. So that's why we're doing that. And you can see on the right side what I just said. So the last slide is about new research initiatives and a clinical trial. So we're excited because we want to try a clinical trial, which is risky since this is only a 6-month-old center. But we want to try to do that. We've raised some money. We have matching funds, by the way. But we want to do this. And so this one's going to look like a rapamycin study. And rapamycin is a disease that is historically, for the last 40 years, is used to decrease the immune system when you have transplantation, so it's not rejected. So that's where it all started with. But now rapamycin's been shown in dogs and a few other type of models to prolong longevity and et cetera. So we want to try to do this. And I'm looking at Mindy because she agreed last week. She's on board. Yanko's been on board for a while. So anyway, but we want to start this in the next 6 months and see if we can get a signal and see if it helps whatsoever. So how'd I do? Okay, good. Thank you. Thank you for your time.
Thank you, Rick. Were you going to introduce Lindsay?
Not yet. We have Senator Mark Kelly. Yep, you just take a seat and relax, Dr. But also I have in addition to everybody in the room, thank you for coming, we have about 100 folks who signed up to join us online. And I've been told by our tech specialists that some of the slides are showing up a bit blurry for the folks joining us online, and our apologies, we can't correct that. However, you will be able to access all the videos on the website. Everything's being recorded after today's session, and to continue to reach out if you're having any issues online. We want to hear about it. And yes, Ms. Westcott. Oh, and the recordings will be in high resolution when you go to access them. Okay. Great. Thank you for that technical interruption. And thank you for joining us online, especially folks in Tucson where we know it's just after 7 a.m. there, so just after 6:30. So thank you very much for joining us. Also, this has been such a great treat for us as part of the initiative. Senator Mark Kelly has been an advocate on behalf of what the University of Arizona is doing. And he has contributed with, he couldn't be here in person, but he has sent a video. And this is the second time he's done this. Oops. Okay, hold on. Why is this? Where's the mouse? There's like 6 mics up here. There we go. Everybody ready? A short video from Senator Mark Kelly about his dedication to helping older adults in Arizona and nationwide.
Hey everyone, it's Senator Mark Kelly. I want to thank the University of Arizona for inviting me to speak at this Innovations in Healthy Aging Summit. We know our state is aging, and ensuring Arizonans have the support, resources, and tools needed to age well, comfortably, and confidently is something that we should all care about. As a member of the Aging Committee, delivering for Arizona seniors is one of my top priorities in the Senate. That's why I helped negotiate a major deal to lower the price of prescription drugs and out-of-pocket costs for seniors. No one should have to choose between buying groceries and paying for their prescriptions. But too often, that's what I hear from folks across the state. But thanks to the Inflation Reduction Act, we're working to change that. We're capping the price of insulin for those on Medicare at $35 a month. And we're capping the out-of-pocket costs for those on Medicare at $2,000 a year, bringing peace of mind to many in our state. We're already seeing the impact that these changes are having on the lives of Arizonans, and there's more to come. And there's more work to do, like protecting Social Security and Medicare, like supporting family caregivers, and increasing access and affordability of long-term care. As we work towards ensuring a secure and prosperous future for our seniors, I'm grateful that you are all coming together to discuss the ways that we can best support Arizona's aging population. So thanks for having me, and thank you for supporting our seniors.
If I could also give a shout out to our government relations office. Senator Mark Kelly, as you can imagine, receives I can't even imagine hundreds of requests for his time. So just thank you to our government relations office, particularly Janelle Biggs, for helping us with this video today. I'm a little nervous about what's going to happen if I hit this button. Oh, thank goodness. Lindsay. I've been a fan of Lindsay Goldman for quite some time now, and when we knew we were going to launch the advisory council and also the summit this year, I was so interested in hearing about the work that she's been doing with grant makers in aging, and something that I think all of us would love to learn more about, how to leverage these diverse resources by creating these networks to support healthy aging research. A little bit more about Lindsay. She has over 20 years of experience in program development and administration, direct service, philanthropy, health and social policy. Most recently, Lindsay was the founding director of the Center for Healthy Aging at the New York Academy of Medicine, and she specializes in the very important public-private partnerships to create age-inclusive environments. So all the way from New York, thank you, Ms. Goldman, for joining us.
Thanks so much, Shara. Okay, a whole lot of microphones.
And I see it's not just me. And then there's the mouse.
Okay, am I using the mouse or the...
You can, yeah, either one.
Okay, cool. All right, so hi everyone, I'm Lindsay Goldman. I am not known for being brief, but I am known for talking really fast. So I am the CEO of Grant Makers in Aging. My pronouns are she, her, and I really appreciate the opportunity to speak with you today. Grant Makers in Aging is a network of funders working to mobilize financial, social, and intellectual capital to improve the experience of aging now and in the future. We create opportunities for funders to connect, to collaborate, and to co-fund. So we help funders who are already investing in aging to fund more strategically, and we help funders who are not investing in aging to either see the light or to identify the intersections of aging and literally every other funding priority. We serve as a convener, as a thought partner, occasionally as a grant maker, and a champion for all things aging. You can see our vision and values. We believe in a just and inclusive world where all people are fully valued, recognized, and engaged at all ages. We believe that diversity, equity, and inclusion are core philanthropic values, and we believe that aging is a core component of diversity, equity, and inclusion. We were founded in 1982 by a group of program officers from some very large foundations that you will have heard of, like Robert Wood Johnson Foundation and the John A. Hartford Foundation. 41 years later, we have more than 130 members representing many different types of funders, including community foundations, family foundations, corporate funders and foundations, and most recently public sector funders and area agencies on aging. These are funders that may not be making grants, but are contracting out millions of dollars for aging a year. And this was a big change for us. But when we're all around the same table, we can reduce funding gaps and redundancies and maximize limited resources. So within the private foundation category, we have a number of healthcare and nursing home conversion foundations. A conversion foundation is when a nonprofit hospital, health plan, or health system is sold or converted to for-profit. The proceeds are transferred into an endowment of a foundation that maintains the general mission of the entity that was sold. So we can expect more of these, particularly in the nursing home space. And on the one hand, yes, this means more money for aging philanthropy, but on the other hand, nonprofit nursing homes have been shown to deliver higher quality of care and better quality jobs than for-profits. So it's kind of a double-edged sword. Here's our geographic breakdown. Most of our members fund regionally or locally, a third fund nationally, and then a small percentage fund nationally and outside of the US. So today I'm going to tell you about how our network and aging as a funding priority fits into the philanthropic landscape. In 2021, the US had nearly $485 billion in charitable giving. Notably, 67% came from individuals, and more than a quarter of that came from ultra wealthy individuals like Mackenzie Scott. Now, how much of this goes towards aging related issues is actually very hard to measure. So I can tell you that between 1% and 2% of all philanthropic dollars support traditional aging services, which help to keep people safe and comfortable at their homes and meet their needs. So things like home delivered meals, senior centers, case management services, really critical programs that address the social determinants of health, but are typically not paid for by the healthcare system. And I can tell you that these services are grossly underfunded and not proportionate to the population. But just as there's more to later life than a visit from a social worker every 6 months, I can say that because I am a social worker, and we're lovely, but there has to be more to life than a visit from a social worker every 6 months. There's more to aging philanthropy than aging services. Economic development dollars, transportation dollars, housing dollars, civic engagement dollars can and should be used to improve quality of life for people who are aging. But it's hard to disaggregate how much of this funding ultimately goes to benefit older people. So it's frustrating from a measurement standpoint, but it's actually a good thing, because while our objective is to attract more funders and dollars to the aging space, our goal is an age-integrated society, because we're all aging all the time. We're aging at the intersection of multiple identities. We're aging while moving between environments. We're aging in relation to other people. And we're all aging while giving and receiving care, sometimes at the same time. It's very messy. Aging is a public health victory, but our institutions, systems, and structures weren't designed for people to live this long, which leads to the exclusion of older people. That's worsened by ageism, which remains rampant and compounds other forms of lifelong discrimination. But research shows, which you all know better than I, that attitudes towards older people can be modified through intergenerational contact, and that a society that engages, connects, and cares for people at every age is a healthier, more creative, more productive, definitely more interesting society. The challenge is that aging funders are few and far between. Funders are also not immune to age bias, and that many sources of both public and private funding are age stratified. So in an effort to target insufficient resources, we can become risk averse, territorial, and trapped in false dichotomies that limit our thinking, like healthy versus sick, caregiver versus care recipient, nursing home versus community dwelling, paid caregiver or family caregiver. And we then use these constructs to deploy capital. This funding is only for people 60 and over. But what about my 57-year-old spouse? This funding is only for caregivers. But what about the person I'm caring for? This funding is only for community dwelling older people. But nursing homes are in communities. They're not on the moon. And maybe I'm living at home today, but what happens if I break a hip tomorrow? These are not mutually exclusive categories, and sometimes it just depends on the day, or sometimes the hour, how and where people identify. Age integration means funding in a way that aligns with how people live, that bridges people of different ages, that trusts that communities know what they need, and that doesn't prioritize one population at the expense of another. In addition to talking about how funding streams can reinforce age segregation, at GIA, we're also encouraging funders to consider power dynamics. This means asking some really tough questions about who we fund, what we fund, and how we fund. Are we funding the same organizations year after year? Are organizations able to cover their costs and pay people a thriving wage? Who's leading those organizations? Who makes the funding decisions, and how are they made? What outcomes are we measuring? How are we measuring them? And who decides what outcomes are meaningful? Some of us have been asking these questions, and as a result, we're starting to see some really powerful shifts within our sector for the first time. Trust-based philanthropy works to rebalance power between the nonprofit and philanthropic sectors, grounded in the values of equity, trust, and transparency. There are 6 principles of the Trust-Based Philanthropy Project that GIA is a partner in disseminating, and you can read more about them at trustbasedphilanthropy.org. But essentially, it boils down to giving more multi-year unrestricted funding, doing the homework so that funders identify potential grantees, simplifying and streamlining paperwork that takes up so much of all of our time, being more transparent and responsive, soliciting and acting on feedback about the grant-making process, and offering support beyond the check. Access to a funder's social capital is extremely valuable to anyone looking for funding. So where are funders investing? Well, first, there are some indicators that they're investing more in aging more generally. Since I started in 2021, GIA membership has increased by nearly 50%, and people who never would pick up the phone when we called are now answering. More specifically, we're seeing significant momentum around multi-sector plans on aging. These plans serve as blueprints for coordinated action on aging across sectors. They're led by the state, ideally from within the governor's office. Sometimes there's an executive order. If you've worked on age-friendly communities, this is really the natural evolution of that model, which also brings sectors together, but at the local level, to improve quality of life by making changes to domains like housing, outdoor space, civic participation and employment, all of the critical components of an age-integrated society. There are around 20 states actively engaged right now in trying to initiate or implement multi-sector plans, and Senator Gillibrand is calling for a national multi-sector plan on aging. California was one of the first plans that has received significant support from philanthropy. So a group of GIA members actually signed an MOU with the California Health and Human Services Agency, and these funders contributed more than $3 million to fuel the development, implementation, and monitoring of the California plan. There are definitely opportunities for academia to contribute to these efforts, particularly through research and evaluation. Caregiving is the second big issue. There's growing recognition that caregiving should not be a barrier to good health, to economic security, and mobility across generations. And that as funders, if we value aging, we need to equally value those people who provide support to us as we age. Caregiving has brought new funders and new advocates across aging, early childhood, economic security, and racial justice together. And we had a major win a few weeks ago when President Biden issued an executive order that includes more than 50 directives for agencies across the federal government to make care more affordable and accessible for people of all ages, and to provide improved job quality for paid caregivers and improved supports for family caregivers. And the Administration on Community Living just announced a new $20 million to begin to implement the National Caregiving Strategy. Third is social connection. COVID was the ultimate experience of social disconnection, particularly for older people. So now social connection is generating significant attention, with the Surgeon General admitting that he is lonely too, and announcing a new framework for a national strategy to advance social connection, which includes recommendations for both philanthropy and research institutions. Social connection comes up under funding priorities of mental health sometimes, as well as community resilience, and sometimes technology. A lot of funding for digital equity right now, with older people as a priority population, which they didn't used to be. A number of our members are investing in narrative change efforts to use messaging to influence policies, practices, and funding mechanisms around issues including aging, caregiving, and the care economy, the direct care workforce, and serious illness. The National Center to Reframe Aging at the Gerontological Society is one example, and the Solutions Journalism Network, which highlights effective solutions that don't just describe, but actually solve social problems, is another. And finally, there's a recognition that for philanthropy to have the greatest impact, we need to change broken or unjust systems and structures, rather than just trying to help people to live and work within those broken or unjust systems and structures. This leads to my next point, which is that systems change requires big solutions, which require big dollars. So in addition to traditional grant making, we're seeing more funding partnerships with funders pooling resources. For example, the Care Fund is raising $50 million to build a movement to provide high quality care for people of all ages and dignified jobs that pay a thriving wage to caregivers. At GIA, we steward a number of funders communities, and regional associations of grant makers, such as Arizona Grant Makers Forum and Philanthropy Southwest, are often particularly effective in galvanizing collective action. Another strategy is impact investing. Impact investing is defined as investing capital to generate social impact and provide monetary returns. Because impact investments are expected to repay and recycle capital, their dollar amounts are typically much larger than traditional grants, and they can help accelerate structural and systemic change. So some funders are making low interest loans or equity investments in organizations. Others are investing their endowments to better align with their mission and values. For example, the Commonwealth Fund increased their investments in companies that are majority owned by people of color and that have significant representation of women and people of color in senior leadership roles. Impact investments can also help communities that have been denied access to capital through traditional markets. Finally, I just wanted to share 4 thoughts on bridging research and philanthropy to advance equity from an article that I co-authored with Latrice Vinson, who leads the aging section at the American Psychological Association. First, as funders, we want to ensure that in our pursuit of evidence-based interventions, we're not perpetuating funding inequities that privilege well-resourced organizations over those that are newer and maybe engaged in promising practices that seem to be working, but that don't have access to capital required for evaluation. Second, both sectors should be committed to diversifying our workforces, grantees, and subjects. Third, we should fund and conduct research with diverse populations. One size definitely does not fit all. And fourth, there's a need to translate research for a funding audience, particularly in aging, where program officers are often juggling multiple portfolios and they're pressured to move money quickly. These people are not conducting literature reviews. They're not accessing content behind paywalls, but they need the key takeaways in easily accessible formats. There's also a need for funders to help fuel the translation of research for a policy audience. So I hope I leave you feeling energized and optimistic about the potential for a more age-integrated and just society fueled by philanthropy in partnership with government, nonprofits, and academia. We're building a movement to champion investments in aging and the aging angle of all investments, and we hope that you'll join us. So thank you.
Thank you so much. Really wonderful to meet you in person. Actually, we've had several conversations today about it's the first time I've met you in person, and it's been several years. So that was fantastic. That was very inspiring. I think many of us at the university, as you see, we have these half-dozen entities that really engage in aging research and just the wealth of possibilities as we explore partnering with private foundations and funders like you have described. So appreciate your time, and hopefully we can ask you questions and guidance in the future. So thank you so much. Thank you again. So this concludes our opening remarks. If our current